I'm Ellen Heed, founder of STREAM. STREAM stands for Scar Tissue Remediation, Education, and Management. I believe that scar tissue is the unacknowledged cause of too much human suffering. So I developed STREAM as an advanced professional training for experienced healthcare practitioners. STREAM gives seasoned healthcare providers of all stripes the tools they need to be effective and address scars to amplify human potential. I'm so proud of the work that STREAM graduates are doing that I made this video series to highlight their accomplishments. In this clip, I interview Victoria Gyore, a certified STREAM practitioner and graduate who works as a pediatric nurse practitioner in the emergency room of a children's hospital in Orange County, California. Victoria joined STREAM in 2021. The way she brings STREAM principles into her work in the ER gets results that are truly amazing. Her team loves working with her because of her focus on emotional safety for her pediatric patients, their families, and for the team at work too. STREAM at Work in the ER. This short video tells the story of Victoria's personal and professional STREAM journey and the resolution of conflicting ideas she held about how she should be practicing her healing gifts. At first, she wanted out of conventional practice ASAP. As she progressed through her STREAM studies, she came to realize the value of carrying her STREAM work into the emergency room. What I love about this clip is Victoria's description of the way she uses STREAM principles while her young patients undergo emergency treatment. What we're doing is we're applying a methodology wherever the practitioner is and wherever the client is that applies to just about everybody. That's why I'm excited about STREAM.
Yes. I was thinking just today, why I'm excited is the didactic part, the workshops, the immersions, those are all healing inside out work and we grow. But I am still just so in awe of my peers and how my peers are inspiring me just as much as the didactic work and the immersions. Like I'm getting fed by the peers. And that feels really good from somebody healing from practicing in captivity and now practicing in the wild, or combining both
Combining
captivity
both really
and
and
wild.
finding that I actually want to talk to you a little bit about that. How is it to be a foot in each world? Because you're in a deeply conventional situation every week that
Yeah.
you're working, and then that you're contrasting it with deeply unconventional situations in your private practice. And I wonder how it is to make the transition and how it maybe took a little while for it to feel more seamless or more effortless. Because I remember in the beginning there was some friction between the two. So I wanted to just unpack that a little bit.
First year, it was like I had two identities, like kind of Clark Kent and Superman. And it was not integrated at all. And I had this feeling of like, oh my gosh, if they find out, and then something happened in the second year. I don't know if the biochemistry healing came on board a little stronger. And then I just was in work one day and I was like, oh, I'm no longer afraid.
What exactly were you afraid of? If they find out, what would happen? Would you lose some kind of credibility professionally?
Because I am a per diem meanings that I can be let go without explanation.
Oh, got it. So that's a real and present danger to your continued career.
And I have bills to pay.
Right, right.
So that was something there, always like present.
Yeah.
But then I just I got really confident, really felt like I got a backbone and a spine, and I felt real connected from my root to my heart to my brain when I stood in front of people. And I just knew that I would need to share what I know and not hold back.
Well, that changed your approach from what I recall in our mentorship conversations. It changed your approach when you're doing your sewing, in your ER, or the choices you're making. And there's been more you're playing let's make a deal with doctors. Let's not do this surgery that might be unnecessary, that will create potentially scar tissue that would potentially change the trajectory of somebody's life as they mature, like their sex life. If we sew up this piece of anatomy in the pelvic floor right here, right now, that's going to produce scars, and those scars could produce pain, and that could really affect somebody's entire sexual trajectory, even though they're only 4 years old now. How's it going to be when they're 24?
Right.
Right.
Yeah. You're talking about physical scar, but then there's this whole emotional scar that we are creating because of the environment we're choosing to do the laceration repair in. That they're going to be pretty much awake. And maybe a little bit of feel like, intranasal versed just makes you feel a little relaxed, but not too much usually. And that what does that emotional scar do presently and long term?
Well, we're back to now this example that I was just talking about of somebody who gets feelings of tingling and arousal in their body watching scenes of torture, because there's something about that I think their soma is responding to. And I think what they are characterizing as arousal might be actually some kind of embodied terror response. This is just me imagining, and I don't know for sure because I'm not in that person's body, and I wasn't the person interviewing this person either. This is a game of telephone. Nonetheless, I think that the body remembers everything, even when we're unconscious, actually. At some level, there's a somatic, that's what somatic recall is made of. Somatic recall being spontaneous memories that come out of the body when certain body areas are palpated with presence and calm and awareness, where both people's attention is placed on one person's experience.
100%. I can't agree more.
Yeah, well, I'm sure you've seen some of that, but it's interesting that you're working in such different contexts. In the ER, you're putting wounds back together through conventional means, but you're also working at deeply emotional levels. So you've told me about some of the ways you guide people when you're stitching or when somebody else is working with them, but you're holding their attention to mitigate the emotional impact of what's happening. And I think that's so beautiful. And I think it's all too rare because people don't have the awareness of long-term effects on the emotional body of what's being performed or what's necessary, especially in an ER. People are there because it's an emergency, so they need some kind of intervention. But the quality and the way those interventions are delivered may have just as negative an impact as the actual trauma on the future life of that person. And so knowing that, I think, can you talk about how that's changed your approach to care?
Oh, absolutely. I mean, my frame of reference is the population I tend to is neonates all the way up into children who are in their early 20s who have chronic illness like cerebral palsy, muscular dystrophy. So that's the range of children I take care of. How Stream has changed is we are mapping emotional, physical scars, wounds, and the psyche. And so what that looks like is my role is to repair lacerations, to do drainage of abscesses, to if there is a laceration in the vulva, that will call me. And then also my favorite is I used to be a bone setter, an orthopedic nurse practitioner specialist, and I used to set bones. And now I do the conscious sedation procedure. So I work in tandem with the orthopedic surgeon who sets the bones, and I give ketamine. And what I love about that is that we get to talk about altered states of consciousness. We get to map the psyche prior. I get to do a lot of anticipatory guidance and tell them where our mind is going and that their job is to track my voice. And it completely works. And we do a lot of education of what their job is to listen to my voice. And when I ask them to take a deep breath, just to take a deep breath and be. And we go in with joy. We go in with excitement, and we talk about their favorite vacation. We talk about their favorite like sports, like their best soccer game they ever played. And I said, if you will go in with that type of excitement and memories and thoughts, you can have the most vivid, awesome dreams. And when you come back, I want you to tell me all about it. And so they go in without fear. And so when they come out, they don't have that same fear. Those who go, and I always say, those who go in with fear come out, especially the preteens and teenagers, can come out teary, afraid, crying. And just my people who I guide don't have those experiences. They come out and they're like, oh my gosh, I made the best goal, soccer goal. Or I was dreaming of, my favorite one was she was dreaming of dragons. She loved to do art and make paintings of dragons, and she had the most vivid dreams of dragons.
Wow.
And then when she came and saw me, I did a follow-up. I think I was still with Orthopedic. She drew the dragon that she saw in her altered state.
How cool is that?
Yeah. And then even a lot of times when you are in this altered state, you forget to breathe. And so I'll just go behind them and do a cranial sacral hold and just hold their occiput. And now I can see their capnography completely change within seconds.
Wow. Amazing. Amazing.
And then, so that means their respirations are improving. Their oxygenation is improving. I don't have to put on the oxygen. Like I've just helped them just with our cranial sacral work that we learned in stream.
This is so beautiful. This is so amazing that including the ANS in the procedure deliberately through a contact on the body can have such a measurable result that you can observe as it's happening. It's amazing to me. The fact that this hasn't been incorporated as many nurses learn cranial sacral work, but I don't know, I haven't heard the stories of people who apply it in practice, in a hospital setting, in the ER, when somebody is having an emergency procedure. So let's talk about agency and participation on the part of your average patient in a hospital setting, because a lot of medical professionals are in a position of delivering cure or delivering treatment and presenting themselves as if they have all the answers, that drugs and surgery are really going to do the trick. And very few ask about participation. And in stream, it's different, right? We don't take our clients' agency away. We ask for informed consent, and we don't progress until we get consent. I know this has changed the way you practice at the hospital as well. Could you speak to that?
There's so much to say.
Yeah.
Give me a minute to kind of collect my thoughts. I think when I'm in the room with patients, I'm listening. Like you were saying in my first session, there's so many different conversations happening at the same time. And so I'm able to hear multiple conversations. There's the conversation that I'm having when I'm doing my physical assessment, and the conversations that we have with the tissues, but also these mental conversations. Then there's these conversations that are happening with parents. And then once I get all the data collection, I can kind of see kind of this feels like a very three-dimensional containment of the issue they're coming with. And looking for what is true here. Where can I help? What is my gift to be offered here? And then offering it in a way, and I usually say very bluntly, because I only got 10 minutes.
Wow.
I will never tell you what to do. I will never force you to do something you don't want to do. My job is to lay out all the options. This is the smorgasbord of options. If you go down this path, these are the likely things that will happen. You go down this path, like what's behind door number A, B, C. And then I lay it out. And then we talk about it. And there's many questions that go back and forth because some of these things are really hard. Some of these conversations are very hard. They're
Yeah.
very complex. There's multi-layers. And then usually, sometimes there comes to a point of, what would you do, Victoria? And then I have a choice.
They ask you that.
Not everybody asks. Some people can just take the information and make a decision, but you know how it is to be in those stressful situations. Sometimes your brain just like, you're in a free state. You can see I'm tracking their nervous system. They're in a free state. The information is going in, but they're not retaining.
Yeah.
So now they're looking for help. And then we don't want to do power over. We want to do that. This is a partnership. And so it's a big responsibility to work with, as the practitioner and families and client and patients, is that we are in partnership, that this is not power over. And it's different. And I think people who watch me work know that I work differently than the average person.
Mm-hmm.
And people stop and pause and watch.
Ah, fascinating. Do you think there's something there that is it healing for them to watch this in progress? Has anyone ever made a comment like that to you? It's curious.
It's a very beautiful compliment when you walk in the door and they say, "Oh my gosh, you're working tonight? Oh my gosh, I'm so excited." Or, "Oh, I'm so glad you're going to be doing all the procedures tonight." Oh, it's a feeling of relief
Mm-hmm.
that
Mm-hmm.
comes across. And it's really a genuine compliment, and it hits me and I receive it. And it comes from it comes from multiple staff members, and it feels really good.